This is a clip from a live carnivore doctor meeting in our Go Carnivore community where we help you reduce inflammation and lose weight with a carnivore diet. You can join us at gocarnivore.com.
So, today we're going to discuss, is carnivore safe for the heart and what will happen to your cholesterol levels and your triglyceride levels and your blood pressure when you start a carnivore diet or continue with a carnivore diet. We're also going to discuss the 5 metabolic tests that every single person needs to do. And then we're going to answer lots of your carnivore questions. So, my first question for you: is the carnivore diet safe for the heart?
Not only is it safe for the heart, but it is beneficial for the heart. And I'm fairly confident in saying that now. I guess to really answer this, we have to go back to why we would think it wouldn't be safe for the heart, right? Because remember, carnivore was our default diet for millions of years as human beings. And the evidence would suggest that heart disease was very rare, if it existed at all. Here in the United States, for instance, we can go back to leading physicians from the late 1800s, the early 1900s, and they didn't talk about heart disease. They didn't see heart disease. It only really started to show up in significant numbers as we go through the early 1900s. And heart disease reached a crisis point here in the United States, 1950s, really especially 1955. Our President Eisenhower, has a heart attack while in office. And this really sets off all the alarm bells, and people start asking, why is heart disease becoming so common? By that time, it had become the number one killer here in the US, and people rightfully asked what was going on. And, I'm sure many of you have heard this before, but there were a number of competing theories. And the theory that really won out at the time was what was called the diet heart hypothesis. And the diet heart hypothesis had two parts to the hypothesis, right? That's a theory. Doesn't mean it's fact, it's just a theory. And the theory was that the foods that we ate influenced our blood cholesterol levels, and specifically foods that contained a lot of saturated fat and a lot of cholesterol would raise our blood cholesterol levels, and that raised cholesterol level is what was driving heart disease, what was causing heart disease. Now, we could, what I'll say is the data for both of those parts of the hypothesis is pretty flawed. But the mainstream thinking became anything with saturated fat, which of course includes animal products, meat, dairy, eggs, was bad for the heart. And this has been the dogma for really almost 70 years now. Red meat is bad for the heart. But when you really dig into the science, there's no evidence to support that. There's no good evidence to support that. There's some flimsy epidemiologic type studies where they say to people, do you eat red meat? And people that would answer yes to that question seem to have a higher incidence of heart disease. Now, there could be many reasons why that is, right? If people are being told that eating red meat is bad for you, and yet they're eating red meat, that means that they're probably not following other health advice, right? Things like smoking or, getting exercise. They probably weren't doing those things either. And that could lead to the increase of heart disease. And the other problem that comes up is when you ask people here in the US, did you eat meat? And they say yes. The most common thing they will have eaten would have been a hamburger with the bun, with the toppings, with the French fries. They probably drank a soda with it. And, they end up with more heart disease. And the scientists at the time, the ones that were pushing this hypothesis, said, well, look, it must be the red meat, that they ate in that hamburger that caused this. So we now know that science was very flawed. The concern around saturated fat has been thoroughly disproven, to the point that it has now been removed from the guidelines. The American Heart Association no longer mentions saturated fat in the guidelines. They quietly released a statement about 10 years ago saying this, but they haven't really promoted it. And therefore, the vast majority of doctors still believe that red meat is bad for your heart. And their patients, get educated that red meat is bad for your heart. But it turns out that red meat is not bad for the heart. And there are actually many beneficial things about eating a meat-heavy diet that are going to be good for the heart. So I have no reservation whatsoever in telling my patients that have had heart surgery, my patients that have advanced heart disease, that they can and should be eating red meat for their heart health.
Absolutely. Let's talk about cholesterol. That is something that people have questions about. Cholesterol is very, very important and one benefit of eating red meat and a carnivore diet. Now, the question for you is, how does a carnivore diet impact your cholesterol levels, your LDL, and your triglycerides?
Yeah. So the first thing I'll say is, when we look at the impact of low carbohydrate diets in general, and carnivore, of course, being a subset of that, the influence on blood cholesterol levels, referring to your LDL level, is variable. The studies, when we look at the large kind of large populations of people doing low carbohydrate diets, the average answer is it has no meaningful impact on your cholesterol level. Doesn't go up, doesn't go down. Now, individuals might see different responses, and those responses might change over time. So, for instance, one of the things I consistently see is that when people are losing weight on low carbohydrate carnivore diets, their LDL cholesterol tends to go up. And then once they weight stabilize, they stop losing weight, their LDL cholesterol will go down. I think there are probably some other factors at play here, but oftentimes people start these diets, right, and they see this great response. They lose weight, they're feeling good, their inflammation goes away, whatever medical conditions, they get lots of improvement. But then they get that first blood work, and sometimes the LDL cholesterol has gone up, and that sort of freaks everyone out. And we'll talk about maybe why it doesn't need to freak everyone out.
To watch the full live meeting plus the Q&A, just head to gocarnivore.com. You can also try our customized meal planner, join our monthly carnivore challenges with our carnivore coaches, and also make friends with like-minded carnivores all wanting optimal health.